Check 1 2, check 1 2.
Good afternoon, Tom.
Hi, good afternoon. Laura, can you hear me?
Yes, how are you?
Okay. I see Abel is on. Now, how do we know what people are looking at on their screen? Do we know?
So I need to grab screen share.
Okay.
And I think Abel, oh, here we go.
Okay.
All right, how we doing? Can you see my screen, Tom?
Yes, I can see your screen. Very good.
Great.
Hey guys, Sable.
Hello, hello.
Okay, I'm gonna. I'm gonna be on the chats. I'm gonna be monitoring the chat and
Okay.
I'm gonna respond to this one gentleman here and let me see if I can give him a link. Meanwhile.
Okay. Hey, Abel, Chris Geldart was trying to register, for the PPE, the segmentation. And,
Yep.
and District of Columbia, where he lives, is not a choice. So
Oh,
can
my
you
bad.
make a note to add that? They've been arguing for statehood forever.
Yeah.
He just happens to be our board president, so I kind of want to make sure we don't forget that one. Hi, Doug.
Hey there.
Hey,
How you
Doug.
doing, Tom and Laura?
Hey.
Very good.
I'm having some internet issues today. I am, fortunately, so I will do my best, but I might have to leave my video off.
That's fine. You got a picture up. That's good. Your audio is crystal clear.
Yeah, as long as we can
Okay,
hear
good.
you.
I was hoping that leaving my video off would help the rest of it.
So, hey, Doug, I just sent out a text on the PPE directory.
Yeah.
So that's operational.
Awesome.
Yeah.
That's fantastic.
Well,
We
and
could use the help.
we're working on Rev 2, which will allow you to download it, into your systems. We're still working through the legal thing. That'll be a subscription fee, but at the end of the day, I think this will be just the beginning. So.
Okay. I have been on back to back, so I haven't had a chance to look at texts.
Yeah, no, that's okay.
But I will.
I sent it out to you and Sherry and Chris and folks on our text distribution. So the one thing about Zoom is interesting is I can't tell what people are looking at, but I guess they're looking at this screen I'm looking at, which is the Laura's slides. Okay.
Yeah.
Okay.
There she is. Hey, Sherry.
Oh, hi. So
Doug's
Doug, are you not going to be live?
I'm going to attempt it, but I've been having some internet issues today. I'm not in Maryland. I'm in West Virginia, so I'm working off a satellite, not fiber optics.
Wow, that's fun.
Yeah.
I only asked because
Not
of
been
you.
too bad.
I was going to take my camera away as well.
Yeah. I might start with the video up, but then I might have to go away if it tells me that it's starting to have some challenges, or you guys alert me that it might be slow, then I'll turn my video off.
Mhm. So Abel hi Sherry. Can everybody hear us, Abel? I don't know quite Zoom webinar like I do GoToWebinar.
Sorry, I was muted. Yes.
Okay.
You there, Tom?
Yeah, yeah.
Okay.
Yes, they can. Everyone can hear us now?
Yes.
Okay. And I noticed that Marcia Workman has her hand up.
Yep.
All right.
So right now they're looking at slides. If you open up the chat, you can see pretty much what the attendees are saying.
Okay. Okay. Cool.
Okay, I'm gonna mute.
So Sherry, I told Doug, I just sent a text out to the group.
Okay,
The PPE directory is operational. Did you see it?
excellent. I did.
Okay. Yeah, good. Yeah, Abel and I have been working some bugs out and, getting this is our first kind of for real SICE level 2 use case, right? So this is like no fooling around. There's an agreement and the data providers competitively sensitive to the information. So we're going to see how this works.
Okay.
Hi, everyone who's listening. We'll get started in about a minute or two. Thanks for dialing in today.
We need some music or something, Laura. Next time.
I don't know. I'm personally tired of the hold music that so many of these conference calls use.
All right, so I just got a text from Chris Eisenbray. He's trying to get on, not clear to how to do it. He said, I just registered.
Abel, maybe you can email him the panelist invite again.
Chris Eisenbray.
Yeah, he doesn't need to register. He has a special link that allows him to be seen when he dials in.
All right, let me send it to him.
It'll come from you, Tom.
Okay.
We still have a few people dialing in, so we have a minute or two.
Okay.
Okay, just resent it to him.
Okay. Yeah, I was thinking music on hold would be like, if I could just hear the theme song from Frozen 2 one more time with my granddaughter listening to it like 50 times a day. Maybe I could just sing it.
So,
Oh my goodness.
You probably have it memorized by now.
Oh, I've heard, I can't even tell you, I must hear it 3 times a day. It's crazy.
Hey, everyone. Thanks for your patience. We're just waiting for one more panelist to dial in, and we'll go ahead and get started.
Doug, where in West Virginia are you?
So we're probably about 45 minutes south of Moorfield, which is right off of that Corridor H, the big freeway that they built. Basically, people joke they built to nowhere.
Right.
Yeah.
That is
So
one beautiful road. Wow.
yeah, it is. It is.
I've been on a lot of.
We've
I've
been
been on a lot.
blessed to have. Yeah. We've been blessed to have a little place in the woods over here on a mountain. So when my wife gets time away from the hospital, I bring her over here.
Excellent. Yeah, I've been on a lot of highways, but that is one of the prettiest and quietest.
And it leads you right to a ski resort if you take it to the end.
Nice. Okay, Chris just texted me back. He said, okay, so probably means he'll join us in a few minutes here. So.
Okay, thanks everyone for your patience. We're just waiting for one more panelist.
This is such a new normal, right? Everybody can just sit and work and keep busy,
Right?
right? Everybody can just work and keep busy until we start. It's great. My dog's asleep. They're doing good.
Mine are too right now. I expect they'll wake up as soon as I start talking.
Right. Right. You got a herd too. You got, how many do you have, Sherry?
Right now I have two. I'm down one. So
Okay, that's right.
Yeah.
I remember you told me
Yeah.
you lost one there. Has the pack
yep.
recovered?
Yes.
Good, good. Yeah, I had a golden retriever one time, and then we got a second one, and the first one passed, and we weren't going to replace the one that passed,
Right.
and the other one just became weird, like depressed. It's the funniest thing.
It happens.
And we've had two dogs ever since. Yeah.
Yep.
Abel, Chris says he does not have a link yet
Okay, I forwarded it twice. I'm gonna forward it to your email, and maybe he'll see if you can bounce it over to him.
Give it, yeah, please.
Okay.
What I'll do then is just make sure I get it. Laura, we may, hang on a second here. We may, let's go ahead and start here, and just to give it one more minute, we can roll.
Yeah. Maybe you can text Abel with the email address just to make sure there's not a typo in the one he's been sending.
Yeah. Well, Abel, if you send it to me, I'll get it to Chris.
Okay.
Okay.
Want me to go ahead and get started?
Yeah, let's go ahead and start. I want to be respectful of folks.
Yeah, me too. Thanks everyone for your patience. We have one more person who's expected to dial in. But I wanted to thank you all for coming to our virtual discussion series today on COVID-19, innovations for response on electric fuel and food. We've been in this pandemic about 4 to 6 weeks now, and there's a lot of early lessons learned that have come out from the industry, and we thought we'd bring the community together to share with you the challenges that we've had across sectors, across our government partners, some innovations that have come about, and just open up the discussion. So as Tom said, it's a new normal in bringing this to you virtually. My name is Laura Johnson. I'm the Director of Conferences and Events for the All Hazards Consortium. A couple of quick administrative remarks I wanted to make today. If you have any questions, you'll find that there's a Q&A section on Zoom. You can just go ahead and type it in, indicate whether or not your question is for a specific panelist or the moderator or Tom, and we'll try to get to it at the end. The webinar is about an hour long. And it will be recorded. So if you have to leave early, or if you want to share this with any of your colleagues or peers, we will have a link that we'll send to you as follow-up. Okay, Tom, I'm going to turn things over to you now.
Okay. Great. Thank you, Laura. Thanks, everybody, for joining us today. I know many of us are homebound, and we had the background for this webinar was we had planned an event in June. We had, 20 plus speakers. So what we decided to do is just break this down. And then, when COVID hit, we decided just to kind of break this down. It's really operational focus, right? So the folks you're going to be hearing from over the next several webinars are people that are in the field, either a trade association or right on the ground at the state or a local level, working the issues with this pandemic that none of us have seen. So we're really glad to have our three speakers today. I know all three of them personally. We worked together for a while, and I'm really glad that Sherry, Doug, and Chris should join us shortly, are able to join us here. So we want this to be
connecting.
Okay, great. So anyway, I want to first thank all of you and our panelists to get into it. So you're going to hear about the SICE. What is the SICE? The SICE was invented by the private sector back in 2013 when emails that were carrying sensitive information got out, and some of that information was sensitive, and it caused a ruckus. So what they were looking for was a way to develop a framework, a trust framework, that would provide legal protection to protect private sector identities and information, so they could share that with government in an operational manner, with each other, state, sector to sector, and with states. So the SICE was developed through multiple investments from FEMA, DHS S&T, DHS CISA, NOAA, NASA, the private sector. It's been a work of art to watch this come together, but it's basically a legal framework designed to vet identities of people, build use cases, kind of like cells of a honeycomb, and a use case is a problem, and inside each cell is the information and the data and the people, and they lock it down. And so it's a very simple, elegant method of sharing information that we basically borrowed from the Defense Industrial Base, has been doing this for decades. So ours isn't quite as sophisticated, but it worked, and the private sector said, let's use that. So it consists of a legal framework, process, use cases, apps, third-party partners, but it's all designed to do one thing: share operational information faster, organize information better, vet and validate that information, and rank it 1, 2, 3, 4 based on reliability. The highest is 1, lowest is 4. So the decision makers can make decisions very, very quickly. So if you hear about the SICE today, you'll understand what it is. So with that, Laura, I'm going to turn it back over. I'm really anxious to hear today's conversation. So let's get into it.
Okay, thanks, Tom. So I'd like to welcome today's panelists. We have Sherry Stone, who's the VP at Petroleum Marketers Association of America, and Doug Baker, who's VP of Industry Relations at the Food Industry Association. Chris Eisenbray is attempting to dial in right now, so hopefully we'll get his perspective on the call shortly. So we'll start with question number 1, which deals with operational impacts. Can you please describe the operational impacts that COVID-19 has had or is having on your association or organization and the current challenges you are facing? Sherry, I'm going to direct that question to you first.
Okay. So we're a very heavily regulated industry. So we have numerous operational impacts. And so I'm just going to quickly go over what the impacts are. And I guess the next question will go over what we have done to try to address that, right?
Right.
So one issue we were having was terminals were denying access to some replacement drivers that were not carded for a particular terminal, but who had extensive experience loading at terminals. And that was a big issue because in past disasters, the terminal operators have allowed for that on-site training. So I'll get into what we were able to do for that. Like everybody, we had the concern about maintaining staff and preventing the spread of disease among employees and customers, as well as communicating to drivers about prevention of a spread of the disease, and particularly keeping their trucks, as clean as possible. So again, I'll get into, I have combined these things in my notes, so I'm just sort of skipping around now. We needed fuel waivers, both the RVP and RFG waivers.
What do those mean, Sherry? What do those mean for folks?
So those are, they are waivers that allow, it's the summertime, at the summertime, fuel has to be blended earlier, but usually I think it's June 1st, but the waiver has moved it out, and that allows for us to use the remaining fuel that's there because we have such a decrease in consumer usage of the fuel. So we needed to basically use up these, the winter fuel, and also, well, that's it, the winter fuel. And then the hours of service waiver is about how many hours a driver can be on the road, delivering fuel. And we needed this waiver because we anticipated that there would be more drivers, obviously, who were sick and or quarantined. And we already have such a shortage of drivers, nationwide for all industries. And so because of that, we knew that we would need to have some of our drivers on the road longer than normal. So we'll get more into that in a little bit. There are numerous licenses that needed to be addressed because so many of the facilities for renewal are closed right now, especially places, licensed that require interviews and fingerprints and things like that. So we're talking about the commercial driver's license, the hazmat renewals, the TWIC renewal, and then there were some other miscellaneous renewals I'll get into. So those are some of our issues. We also, of course, the virus has affected our industry because, of course, driving fuel usage is way down. And although fuel is a low margin part of our businesses, it's still especially important because where the most income comes from is inside the store. And usually people go to the store because they've gone to fill their gas tanks. So that has hurt us. The payment protection plan is helping with some of our members, but like everyone, of course, there's not enough funding there.
Right.
So we also, another issue that has come up quite a bit are requests for information from the government departments, like there was this, everyone knows about this, I think, in the industries, the essential workers document that has been written and then used by the states, by most of the states, to determine who could leave their homes, basically, which businesses could stay open. So we worked in the initial draft of that for our sector, and then in the subsequent documents.
Right.
Do you want me to keep going?
Yeah.
Okay.
You
So it
probably
sound-
could go on for quite a while, Sherry.
I
So
really
Sherry,
could, so I don't want to.
No, that's
Sherry,
great.
Sherry, as a trade association, you had policy, right, regulatory issues, I'm sure, that were going through the roof that your members needed relief on, right?
Yes.
And can you talk for a second about maybe your members on the operational impacts on them? Were they short-staffed? Were people getting sick? Can you talk about that for a minute, the folks down at the ground?
Yes, definitely. So you're right. Our members needed to communicate how to keep people from getting sick, and if they were sick, to prevent spreading it. And so, of course, we followed the CDC guidelines and also sort of put together documents that would help with our members specifically. Based off of those guidelines. As I mentioned before, the driver shortage definitely has already become a bigger concern, because some of the marketers are very small businesses, and they may only have one, some might have one, you have others that have a large fleet, but there are some that have just one or two trucks or drivers. And so if someone is out, they're in real trouble. And unfortunately, there have been more more people sick or quarantined.
Right.
Is that what you're getting at there?
Yeah.
Okay.
Yeah. Thank you.
Hey, Doug, do you want to add anything on behalf of the food industry to that question?
Sorry, Doug.
Yeah, sure. So in addition to many of the things that Sherry said, which we also felt from transportation and staff, hours of service, some new things sort of came to light that we'd never experienced before because of some of the increased sanitation. So a good example is the PIN pads that you use to enter your PIN number when you're paying. We were starting to short those out really frequently. They have a tamper resistant element in them. And because they were either being wiped down with a hand sanitizer wipe that was too wet, or a customer was spraying them because they wanted them sanitized before they touched it, it was shorting them out. And so we were having to send those in, and not just one or two. Companies were sending in 50 to 100 at a time to be repaired. The problem with that is that organization that actually provides those was reducing their staff in order to create their own social distancing. And so you'd send in 50, you'd get 25 back. So we had to quickly work on what is a solution to that. And it started off with messaging, and it eventually became, a protective cover that can go on it so that it didn't matter how it was sanitized. So most recently, because this is being managed, from a state to state to a locale, many of those waivers that go into place, or those proclamations, were creating some issues as transportation over the road. We talked about it many a times. If one area was quarantining, the driver would get concerned that if I drove through it or to it, I would end up having to quarantine in place. So it required a lot of communication and over communicating and re-communicating what those proclamations meant. And it wasn't just to the private sector, but it was also to the public sector, that when you create these proclamations or declarations, that you need to think about the implication of that. This industry, the food industry, as I'm sure many do, has many arms and legs. And unfortunately, one of those arms or legs was getting cut off every single time a new proclamation or declaration came into place. Masks is a good example. So first it wasn't don't wear them, then it was maybe wear them, then it is you must wear them.
Right.
All along, the supply was always strained. And having a wife that's an ICU nurse, I wanted to make sure that group was getting their masks. So when they went to cloth masks, it was a real relief. But unfortunately, there are individuals that like to take advantage of a time when the people and even the government are somewhat vulnerable. And we've had some bad actors out there that have tried to take advantage of the situation with cloth masks. And so we have members who have placed orders and to never receive them, or to hear that they were seized by FEMA when they weren't actually even seized, they weren't even shipped. So there's been some real challenges there as well. But people are starting to get organized. We're starting to be able to see through the woods and try and get some relief for this group. And appreciate the text today, Tom, about the PPE resources, because we can use all the help we can get.
Doug, do you think people were blaming FEMA because it's just easy to do that? Oh, FEMA stole it, or do you? The rumor mill runs rampant all the time, as you know, and it's easy to blame FEMA because they're so big and they can't defend themselves necessarily against stuff like that. Could you tell fact from fiction?
Well, yeah, and we've, one of these slides that talks about partnerships. And so I've been doing emergency management for the food industry for about 4 years now. And I feel that we've created a pretty good partnership with FEMA. It has been tested through this because of some of those statements. FEMA is an easy target because they're always out in front when it comes to a crisis, whether it be federal or state. But the other thing you got to understand too, it's a very large organization. So similarly to a retail headquarters of a grocery store chain, what is decided in the headquarters, by the time it makes its way out into each one of the individual stores, there's a lot of variations of that. And so the messaging from federal FEMA here in DC is one thing, but potentially what happens out in the States might be something different. And a lot of times they're a corporation or organization themselves who have those communication challenges as well. But I do believe that they, as you said, they're an easy target in many situations. And we're hoping to fix that with our partnership.
Great.
Thanks, Doug. I do think that we have audio for Chris Eisenbray from Edison Electric Institute. Chris, are you there?
I think I am.
Yes, you are. Hi.
Loud and clear. Awesome. Welcome, Chris.
Yeah, it's been quite a challenge. IT and technology has been more of a struggle than dealing with the virus at this point for me today. So.
Yeah. Don't feel bad. I don't know what's worse for me, COVID or learning Zoom.
Well, I just got off a webinar for WebEx, and it was quite a challenge. So, so Zoom is pretty easy. So thanks, Tom. Thanks, Laura, for inviting me and the Edison Electric Institute to this really interesting discussion. I wish I would have caught the very beginning of this. I hope I'm not going over some ground that has already been covered. Just for those who aren't aware, Edison Electric Institute, we're the trade association and public policy advocacy group based here in Washington, D.C. That represent all the investor-owned electric utilities. So these are the utilities that service and provide service to probably 70 to 75% of end-use customers. We make up about 75% of market share, customers, electricity provided. So no matter how you slice it, we're about 3/4 of the industry. We have 2 other trade associations that we partner with a lot, especially during times like these where it doesn't matter what your policy positions are. We're trying to unify as an industry across all those business models, and those organizations are the American Public Power Association, who represents all the municipal utilities here in the country, and the National Rural Electric Cooperatives Association, who represent all the cooperative electric utilities across the country. And the reason I mention them is because our whole body of work under the COVID-19 coronavirus scenario that we're all living and working through is because we unite in times like this. We may have different of opinions on Capitol Hill or between in front of our regulators on issue X, Y, or Z, but when we have emergencies like this, hurricanes, large storms, earthquakes, but now we're dealing together with a pandemic, we we work under an umbrella organization called the Electricity Subsector Coordinating Council, or the ESCC. And gosh, I've been working from home since March 12th, so that's 6 weeks as of yesterday, not that I'm counting. But we very early on, and even before we shut down and started working from home, I'd say middle of late February, we got together with the other trade associations of the ESCC, again, the Electricity Subsector Coordinating Council, and started planning for this, the scenario to play out, never thinking that we'd really be here where we are today. But we started thinking about the things that our member companies and their member companies would be dealing with. You know, it's February, March, April. This is starting to be high time for storms. And a lot of our restoration workers, linemen, you know, they have to work in close proximity to each other. So the ESCC started thinking about, well, what does the world look like if a big storm hits and we have to bring in crews from all over the country? What are the obstacles that the COVID-19 scenario is going to play and wreak havoc with? And we started planning on what does mutual assistance, and that's the framework that where our industry brings in crews from across the country, from all corners of the nation, in big events like this or large hurricanes to work and get the power on. You know, what does that work look like? And you know, linemen, you know, they are in the trucks together, they're on the lines together, but if they have to keep social distance and 6 feet apart, what does that look like? What kind of equipment do they need out there in the field, whether it's masks, face coverings, you name it. So we've been working on that. We've been working on how can a power plant, how can a transmission operations center work in the event you have, well, first of all, you want to prevent the sick from mingling with the healthy. It takes people to run those operations, but also what happens if someone does get sick, and what do you do, and how do you protect the people in the plant? So sequestration of employees has been something we've been working on for weeks and weeks now. And another area that we've been working on is the supply chain issues. What kind of supplies would we need as an industry? Not wanting to take away from other critical infrastructure workers like our healthcare workers, but what could we get as well? We don't want to be, I guess the statement is, pigs get fat, hogs get slaughtered. We didn't want to ask for too much. We didn't want to be the hog. We're okay, you know, but we did need to get some of the PPE and other equipment that our members and their employees needed. So just a lot of planning went into what we're doing now for a couple weeks until it got really serious, and all of the work that we've been working with our members, with the other trades, and under the ESCC has really paid off. We're pretty well positioned, and we're as you noticed, the lights are still on. We got through a big Easter storm last week relatively well, and the protocols around social distancing and PPE and how do we do that work really paid off as well in that scenario.
Chris, you guys don't, I'm sorry, Laura, just a quick one. Chris, you also had a big fleet movement issue last week when
Right.
the storms hit, right? So your members were actually moving amidst the COVID, pandemic. Did you hear, or did you guys feel or hear any issues on the ground that were impacting these folks moving across state lines? I mean, they were coming from all over the place, it looked like, there for a while.
Yeah, so what was interesting is all signs point to that it went pretty well. I mean, we had the protocols in place, and our members and the other trade associations members were following them pretty well. One big challenge was 60% of our workforce are actually outside contractors. So they're not employees of the utilities, and trying to get the word out to them, to our contract partners, on this is how you should be doing business in this type of environment, and also getting it to the labor unions, the IBEW in particular, and making sure that their members were all on the same page with us. I wouldn't say it was a challenge, but it was just another another gating item that we had to go through to make sure that everyone was as safe as possible. What was interesting about last week's storms is we did bring crews in from across different states. I think 21 states were impacted, and we brought crews from an additional, let's say, 10 or 12 states as well. But because we had the time to plan for this since February, companies realized that they were going to have to rely a lot more on their in-state resources than out-of-state resources. So I would say if you took this storm and took it out of the COVID environment, you would have had a lot more cross-country traveling than you had with this storm, because our members were able to plan for that and try to avoid having to bring any crews in. But crews were brought in, and the work that the All Hazards Consortium does with alerting us, our industry, on what the closures are, or what the regulatory environment might be in a state, the quarantine. I know that one of the other speakers was talking about that as well. So that was definitely a helpful thing to get us from point A to B.
Chris, thanks for sharing some of the things that you've had to think about. That actually leads nicely to the next question that we have coming up. So I'm going to go ahead and skip to initiatives. So Doug, I'm going to ask you to start with this question. How have you addressed the operational issues that the pandemic has caused your sector, and what initiatives have you taken?
Yeah, so, obviously, we, for about 10 to 12 days, we felt some pretty unprecedented demand from consumers as they started to pantry load. Some people would call it panic buying. I would prefer to call it response preparedness, and consumers were just trying to be prepared for whatever might come. And that type of demand put some significant strain on the supply chain. So quickly, the industry, working with their trading partners, started looking for ways to create efficiencies in the supply chain in order to be able to keep manufacturing moving 24/7. And this group knows better than anybody that a critical disruption in the supply chain literally cuts it off. And we did not experience that. So we're also consumers. And so, I always talked about it being a demand issue, not a supply issue, because it really is not a supply issue. But we had to find efficiencies in the manufacturing facility. So we started looking at what are those slower moving SKU pack sizes, flavors, and scents that we could suspend in order to put more manufacturing time into those SKUs that were in the highest demand. Typically a manufacturer carries about 12 weeks, and I'm going to use paper as an example because it's always on the top of everybody's mind. They have a forward warehouse. So when it comes off the manufacturing line, it goes into the forward warehouse. The retailers and wholesalers are buying from that forward warehouse, and the manufacturers are refilling that forward warehouse. Within that forward warehouse, there's about 12 weeks worth of inventory, and that's what we call safety stock. That 12 weeks worth of safety stock was sold in 10 days. We had one retailer that talked about the fact that they did more online orders in 1 hour than they had done typically in 11 days. So that type of demand on the system is gonna really put some strain on it. And I think it's been extremely impressive how resilient the food supply chain has remained. And it's only remained that way because of the entire supply chain, right? All the way from the manufacturers, the ingredient manufacturers, the production manufacturers, to the drivers, to the grocery stores. And so working with manufacturers, we were able to identify some of those opportunities. Parallel to that, we also needed to start thinking about food security. So during any crisis, SNAP and WIC, hot meals. And it was having those conversations with USDA to make sure that those funds were replenished and replenished frequently.
Doug, what is
then
SNAP?
You throw on top of it that, yeah.
What is SNAP?
It's basically food. It would be the equivalent to food stamps, what we used to call food stamps.
Got it. Okay, just for people who didn't know.
Supplemental Nutrition Assistance Plan.
Okay.
And then WIC is Women, Infants, and Children.
Okay.
So, and that's all tied to food security, right? So, then think about the fact that, 54 cents of every dollar, every food dollar is spent away from home on average. And restaurants were closing down or reducing their service. Fast foods were closing down or reducing their service. So that 54 cents is now coming back into the grocery store. Maybe not 100% of it, but a large percentage of it. So that volume came back as well. And that's just a significant amount of in a short period of time to switch. You can't flip the switch as quickly. So here's one of the things, one of the initiatives that we took, and it also leads to the partnership conversation on a future slide, is we knew that there was inventory and resources within food service that could be made available to retail. And so we quickly reached out to the International Food Service Distributors Association and created a platform that would allow food service distributors to communicate with retailers what availability they had, and retailers to communicate to the food service distributors what their needs were. And that was food, it was people, it was equipment, and it was capacity. And through that, you've probably seen in the press that there's been some pretty good partnerships that were created. Kroger has one with Cisco and has been working with them. We have some folks down in North Carolina that have been working with Performance Food Group. So those partnerships have been created, but they still had some challenges that we needed to go back to FDA and USDA and get some waivers, because food in food service is very different than food in retail. From the packaging, the way it's produced, toilet paper in a restaurant looks far different than toilet paper in your home, as well as the way bacon is shipped into a restaurant versus the way you buy it. Mm-hmm. So it took some waivers from FDA and USDA, and it took some labor to reposition and repackage it to get it into the store to sell it. We still could not, the demand on those specific items could absorb. And so now we're working with the USDA. As you saw, they offered to buy $5 billion worth of food, and they're going to put it into boxes. And then a lot of that's the fresh produce. They're going to put it into boxes and get it to food banks. But the other thing that it's going to do is, we have 500 tribal nations in this country, and they're facing a lot of the same challenges, in many instances, even more challenges than what we're facing in urban settings. They don't have grocery stores that are, within a block of their home, or even within 5 miles of their home. In many instances, they have a C-store, or they have to drive off the reservation and multiple miles to get to that food. And so we've been working with this additional food security issues.
Okay.
Thanks a lot, Doug. Sherry, I'm going to ask you the same question. Are there any initiatives that you would like to share with our group as it relates to fuel industry?
Well, I can, yes, definitely. We, just to respond to what I laid out earlier, we did seek out and receive the waivers that we needed, the regulatory waivers, all of the license extensions and flexibility requests, for instance, the alcohol and drug testing flexibility, and then the other license that I laid out earlier. With the terminal issue that I mentioned, we were able to work that by talking to the Terminal Association and, basically just figuring out why there was a problem this go round, since there hasn't been in the past. And we relayed the information that they provided to our membership, and also created a template, a protocol template that our members could use if they have an employee that they find has either tested positive for the virus or has been in contact with someone. So that was just to help, again, with the terminal issue, but also just in general, that was something that folks could use. We created a couple guidance documents for our members. And last week we responded to a DOE mask initiative. Basically, DOE had outlined a system where they were going to help the energy industry get the face masks that our members desperately needed and still need. And so on Wednesday night, late Wednesday night, I received an email and we responded to that. The next day, we got a notice out to all of our members, which there are thousands, and got everything back to DOE by 5 o'clock on that same day. So we literally had, we hope that we'll be getting at least most of those masks to our folks, because I'm sure, like everybody, it's that's a big problem, to protect the safety of our workers. So that was another initiative. And then just in general, we've been working disaster reform and response issues for a while now. And, things overall are so much better. And we also created a program for people who are looking for fuel during a disaster, so that they can find folks that may be way out of the area, states removed from where they are. And so that's a service we provide to anyone that needs it. And that is in response to disasters in general. There's a lot more, but I think I'll stop with that.
Okay, thanks, Sherry. We lost your video, but we can hear you just fine.
Yeah, okay.
All right, great. All right, no problem. Chris, you talked when you were introducing yourself about some partnerships you had with other electric companies. Are there any other key partnerships that you either utilize that you already had in place, or new ones that you've made, whether private sector or within the government, as a response to what you're doing in COVID-19?
Yeah, some have been in place, some have evolved over time, and some we just stumbled upon this week out of pure need and necessity and supply and demand, and I'll explain those. Number one, well, Tom didn't pay me to say this, but we've been a strong partner, strategic partner with the All Hazards Consortium since about 2012, 2013, and we're a national organization. We deal with the federal government. We deal with the Department of Energy, the Department of Homeland Security. But at the state level, we tend to, we deal with the national organizations of state organizations, if that makes sense. So in the regulatory space, the state regulators that our members work with or work under, there's a organization called NARUC. It's the National Association of Regulatory Utility Commissioners. Well, we usually deal with them, but NASIO, the National Association of State Energy Officials. They're DC-based energy state-level energy groups that are based in DC. But when it comes down to operational touch points or operational information or dialogue or discussions, we really tend to lean on the All Hazards Consortium in the area of emergency management and disaster response. So Tom had mentioned earlier about, when we move crews through our mutual assistance framework and they need to get from point A to B, I tend to be reaching out to Tom and the All Hazards Consortium to get more of the ground truth on what's going on in the States than I would through some DC-based organization that represents those communities. So that's number one. Number two, back at the federal level, I mentioned the ESCC, or the Electricity Subsector Coordinating Council. I didn't really describe what that was, but what it is, it's the forum where our CEOs, the CEOs that make up EEI's membership, they can interact with the decision makers, the executive level decision makers at the federal agencies that deal with energy policy. So the DOEs, the DHSs, FERC, those agencies, and the ESC brings those two groups together at the leadership level to problem solve and to find out what are some regulatory or policy issues that can be worked on to help in the midst of an emergency or before an emergency, to make it easier for our industry to respond and the nation to respond. So through the ESCC, we've been holding twice a week calls with the likes of Chris Krebs from the Department of Homeland Security. I think he's been on every single call we've had on Mondays and Thursdays since this whole thing started. We've had Dan Bruyette from the Department of Energy, the Secretary. We've had Admiral Gerard, I can't even pronounce his name, but he's basically from HHS, and he's been on the presidential White House briefings handling the testing issues around coronavirus. So we've been dealing partnerships through that framework as well. And then finally, the one that I said we kind of stumbled upon, one of the key supplies that our industry is in search of, but also the medical industry is in search of, the healthcare industry, is cleaning solution or hand sanitizer or ethyl alcohol based products. Obviously you want to be able to keep the hands clean and the surfaces clean as we go through this. And we, like other industries and like the healthcare industry, are having difficulty finding that type of product. We happened to start a dialogue this week with, I'll just say, one of the largest ethyl alcohol producers in the world. I won't name the company because we're still talking to them, but they have the capability of producing 20 to 25,000 gallons of ethyl alcohol hand sanitizing product that you can use on your skin, you can use on hard surfaces, 20 to 25,000 gallons of that per day. And we're working with them to make some part of that supply available to our industry. That's still in the works, but those are just some examples of some of the partnerships that we've been working on, whether it's state level through the All Hazards Consortium, federal through the ESCC, or just dogged research with the private sector.
Okay, that's awesome, Chris. Doug, you mentioned a relationship so important to you with USDA. Did you have any other partnerships that were forged during this time, or did you even reach across to another sector to help you with your initiatives? I see you shaking your head, but
Yeah, so I mentioned the International Food Service. I mentioned the International Food Service Distributors Association as being one. Typically, grocery stores and restaurants are competing, so we've come together at this time. Another one that we propped up, it was a partnership with Eightfold AI, and it was around a talent exchange, understanding that there was a lot of people who are going to be furloughed or out of work due to an entire industry being asked to shut down or reduce service, and the grocery retail supply chain industry needing help. We've been able to put up this technology platform that allows companies like a Macy's to load their staff, all of their associates, into this database. And then on the grocery side, the retail side and manufacturing side, they can go in and actually start a recruitment process to be able to hire a little over 2 weeks ago now. And it's been pretty good. We worked out a couple kinks. As anything moving that quickly, you have to. But we've got hundreds of thousands of people that are in that platform right now, and many retailers are hiring them off of that, as well as if they show up in a store. So that was another one. I'd love to echo Chris's comments about the partnership with All Hazards. I think this private sector group, there's a lot of work that gets done, and I love the way Tom has the group set up. It's to get in and get stuff done. I think it's great. Federal motor carriers, fantastic. First time ever in the history of this country that we put together a national waiver on hours of service. And so I think that was extremely important. So there's been a lot of partnerships that you probably wouldn't otherwise expect. They've come to life through this.
Thanks. And we also had an interesting comment that was chatted that back to Chris's point with the hand sanitizer, that Exalta, which is formerly DuPont, is another company that's been able to mass produce hand sanitizer. So Jeffrey Driscoll, thank you for that comment. Sherry, did you have anything you wanted to add about any key partnerships that you might have formed recently?
Well, we've had multiple weekly calls with government departments like DHS and of course FEMA and DOE. We also routinely interact with our state associations because we are actually a federation of the states. So that communication is very good. And through that, sometimes we work with the state energy, the EOC offices. We've also worked with the associations we typically work with on any issue, and we've had weekly calls with them. And then other associations that we work with, but just not as often, like the National Tank Truck Carriers Association. And we worked with them on getting out some communications on different issues. Of course, all hazards, it's wonderful, and often work with Tom and all of you and Laura. And then, yeah, I think that pretty much covers it.
Okay. Hey, Sherry, what about innovations and solutions that you've considered or implemented to developing a more resilient service for your customers or your members?
Well, other than what I've already talked about, let me think about that. Maybe
Yeah.
jump to someone else, because I feel like I may have covered
Yeah,
that.
some of the questions are blurring with each other. So,
Yeah, definitely.
hey, Chris, did you have anything you wanted to add regarding innovations or solutions you may have thought about or even done as a result of what's going on right now?
Well, a couple things. I think, and I'm not trying to plug a particular organization or platform, but we have found that, we're a Microsoft 365 shop at EEI, and, we've dabbled a bit with their product called Teams, which is their collaboration platform where you can do things like this, or you can, text message and those on one platform. And we would play around with it in my group and our larger department at EEI, trying to become innovative and trying to, be a little more technologically leaning forward within EEI. But this, obviously, coronavirus and the COVID-19 situation has really forced, it's a forcing factor to get everybody across the organization to rely on those platforms. And I'm finding myself utilizing that platform more than email than I used to. It's really, it's kind of flipped it on its head. And I wonder when we go back into the office, whenever that is, when that might be, will I continue to be using a platform like that, or will I go back to old email? I have a feeling I'm getting really comfortable with the technology, and I'm going to just stick with it. So that's number one. Number two, I wouldn't say it's an innovation, but it's a good story on being prepared and planning. And I would say this past summer, we put together what I would consider EEI's first business continuity plan, or continuity of operations plan. And continuity of operations or business continuity plans tend to be very IT centric, and it's about, do you have the access to the technology that you need to do your job, and it tends to be driven out of IT. We kind of took a fresh look at it because we play a unique role within our industry. The work that I do and the work we do through the ESCC is that we are we're kind of the industry-wide representatives of our members when there's a disaster. So we needed to really brush off any old business continuity plan that we had and make it and bring it up to speed. And we did that over the summer, and we finished it in probably September, October timeframe. And within a couple months, and we get the first COVID-19 patient diagnosis in our building. It wasn't our company, but it was in our building on March 12th. We triggered that plan, and we've been working under that plan since March 13th. So it's just a good story about being prepared and having those processes and procedures and technology in place, so you can work much easier than you think you could have from home.
Well, and
Sorry, just a quick question, Laura, if I may. Chris, are you thinking after COVID that you're going to have to go back and revisit these continuity plans?
Well, our continuity plan calls for us to do an after action within 7 weeks. So within a couple of weeks of us coming back, we will sit down as an organization and figure out what worked, what didn't work, what do we need to work on, what are the gaps. That's great to do after the fact, but you don't want to lose any of that that knowledge along the way, because you can I forgot what I was working on 3 weeks ago because things have been pretty hectic. So along the way, we've created a kind of a bulletin board within Teams to just throw in, hey, here's some new ideas, or hey, this didn't work, or this did work. So we have a running list in real time of things that we either need to improve on, or things that worked or didn't work. So.
And that is a nice lead into our next question about planning. And Chris, how are you planning for the weeks ahead, whether it's inside of your organization or external relationships?
Well, externally, again, through the ESCC, I should have mentioned this earlier, we've created a resource guide. Someone else on this panel said something about a guide that they created, and we've created the resource guide for the industry. Various different topics and how to do X or how to do Y in this new environment. We'll continue to work on that. It started out as a 6-page document. It's now a 75-page document. Pretty soon it's going to be a little unwieldy. It's getting to that point, but I think that's what we're planning to do, along with our regular work. I mean, Tom knows I work on a lot of other things other than coronavirus, and everyone on this panel does as well. So just continue to do that work. So that's more externally. Internally, I just wonder, it's more of a question, when EEI will go back into the office. We're working pretty seamlessly right now out of the office. And in my mind, the only reason I would need to go to the office right now is if I was holding some big meeting or meeting with people. And obviously that's not in our future right now. So even if DC opened up, let's say in a couple weeks or a month, I think it's gonna take a while for us to get back to where we used to be. And I have a feeling I know our member companies are thinking about, just because they've gone through the experience, that there are some functions within their companies that may not need to go into the office. They may not need to be in that environment anymore because they've proven that they can work outside of that environment.
Right. Hey,
So,
thanks, Chris.
Yeah.
Doug, I'm going to ask you the same question. How are you planning for the weeks ahead?
Sure. So internally, we have started looking at, what happens if the office is open. We're in Arlington, Virginia, and Crystal City there. And so we've been setting up more of a phased approach to returning to corporate office. Agree with Chris, there's not much reason for us to be there unless we've got to meet in large groups, and we probably shouldn't be. But we've talked about alternating offices and workstations, and then alternating days so that people can come in. Of course, I'd be one of the last people to go back because my wife is an ICU nurse. So they've given me the permission to work from home for the duration. So we can make sure that we don't spread. But it's also the other thing we're working on right now and moving forward is just making sure that our staff take the time to decompress. For many of us, it was a 24/7 there through March. And, while the supply chain was feeling the demand that it was feeling, nobody was taking time off, including Saturdays and Sundays. So we got to make sure that our staffs, our most important resource, or our people, don't also burn out. Externally, we've been having a lot of webinars with categories, with manufacturers within categories. Today, we had a webinar with 4 paper suppliers: P&G, Kimberly-Clark, Georgia Pacific, and Global Tissue Group. And it's really just to understand where they're at in their supply chain, some of the challenges that they're seeing, what are the modifications that they're making to their manufacturing in order to be able to catch back up and start refilling the stores. And it's been really interesting. We're not out of the woods by any means. There's 2 types of fiber and paper. There's recycled fiber and there's virgin fiber. Recycled fiber right now is extremely difficult to get your hands on because there isn't a lot of production of recycled fiber right now. And so those facilities that convert that into recycled fiber have been closing down. So it's putting pressure on virgin fiber. So we've been having a lot of conversations with those manufacturers. And then the other thing we're working on right now is we're a part of, some of our members are a part of a White House task force, as well as the U.S. Chamber task force, to help companies that have been closed to understand what they need to do when they start to reopen. And so we've drafted a few different documents on what it's going to be like to reopen and rejoin the front lines of COVID-19.
Okay. And finally, Sherry, anything you want to add to how you might be planning for the weeks ahead? Oh, you're on mute.
Yep, there you go. Thank you. Yeah, so just to echo some of what Doug just said, we're working with some government and industry groups to help put together a guidance document for reopening, and also on testing for the virus. We will continue to work with our state association executives, who are great about giving us a heads up when they see a problem coming that we can try to get out in front of. We'll continue to do that and just continue very thorough communications with our membership. And they're all pretty good about letting us know when there's something that needs to be addressed. So that's what we'll continue to do.
Okay, Sherry, we don't have too much time left in a webinar to really thoroughly address question number 6, but as we are closing things out, do you have any last thoughts or recommendations or suggestions so that others on the call can better improve their communication or resiliency with their own companies and their own sectors?
I mean, much of what we said today has to do with communicating with other similar groups or groups that may have problems similar to yours, and trying to find out how they address problems, or how you might even address problems together. And then reaching out to government offices, both federal and state. I think those are the main things. And joining on these weekly calls that so many people are having, it's helpful. A lot of the information is redundant, but there's always something in each call that you're like, oh wow, that's going to be a problem for us, or that's an opportunity for us. And if you can jump on that, it's very helpful.
Yeah. Thank you, Sherry.
Sure.
Hi, Chris, any last comments?
No, nothing on that last question. And I think I've covered probably more than enough on this call.
We really appreciate it, Chris. Thanks. Doug, do you have any last comments on question number 6?
Yeah, I would just say U.S. Chamber is starting to do some webinar series as well. These conversations are great. So, I know we can be on webinared out, but anytime you have an opportunity to learn from somebody that's been through it, take advantage of it. We have member companies who have business in China and Italy and South Africa, and we've had them on 2 or 3 different calls over the course of since probably mid-February, just sort of trying to learn what they're going through. So, look for those opportunities, and don't hesitate to reach out through Tom if there's anything that any of us can do to help share some more information.
Hey, thanks, Doug. Really appreciate it. As a reminder, if you have any questions, feel free to go to Q&A section, type in your question for the panelists. We'll have a couple minutes with our panelists today to answer any questions that you have. Tom, did you have anything you wanted to start with?
No, I think one comment is 60 minutes is impossible to do one of these webinars when you get into these discussions. So we'll revisit that. No, I don't have any at the moment, Laura. I know there's been a couple that have asked. Maybe.
Yeah, I have one here from Peter Murray. It says, are you using any different approaches to analytics, such as scenario-based planning with probabilistic risk-based scenarios for supply and operational deployment? So if anyone wants to take that.
This is Doug. I would offer one thing on that. So we work with a consultant called Oliver Wyman, and they're in-house with us, and they're global. And we've been having weekly calls with them, and we've actually been looking at scenario planning from a medical side in order to inform the supply side, the food supply side. And so what we did this morning with them was sort of looked forward over the next 2 to 3 months, and as what's the potential impact of different states and locales reopening. And we looked at it around the world. And based on how governments manage this crisis individually, you could see the forecast of those impacts differently. And so there's a pretty strong opinion here in the US that we will have more of a roller coaster type activity where we're going to have the number of cases are going to drop. We're going to open up. The number of cases are going to go up. They probably won't go up as high as they did before, but they're going to go up. And we're going to make some modifications, and they're going to go down again. And we're going to cycle through this for at least the balance of this year, potentially into much of Q1 and Q2 of next year, until we're actually either get herd immunity or we start to get more of those vaccines in place. So that's really going to be important, because every single time those cases spike, we anticipate we'll also see a spike in demand of food as people will have to then re-shelter in place.
Okay, Doug, and out of the panelists, I believe you're the one that would have the most cargo, actual cargo. So someone has asked, thanks, Susan, are you noticing an increase in cargo thefts?
We haven't, that sort of goes back to Tom and my conversation a little bit earlier about, FEMA sort of being the bullseye whenever anything goes wrong. The only thing that we've been having some issues with is PPE, and there's been some shipments have not arrived or have not been picked up, or have been, the distributor has said that it was because it was seized by FEMA. And so, but as far as actual food being taken, not really. We did have a full truck early on in the process. One retailer was receiving a truck of PPE, and it was taken in process of getting to that facility, but it has not been a significant issue yet.
Thanks, Doug. And one more question. What caught you off guard, or what surprised you in your response efforts to this? Anyone can take that. It's tricky.
I can offer one. I was surprised we were going to sell as much toilet paper as we did.
I was surprised about that too, Doug.
Doug, is there any explanation why that was run on the bank, if you will? That caught me off guard as well. I was like, really?
Yeah,
People panic.
Yeah. Yeah. Tom, if you think about the categories that spike during a natural disaster, toilet paper is one of those. It's a luxury item. And I can only imagine that people don't want to, have to use leaves from the yard or newspaper or magazines, and they want their comfort. But if you look at those categories, toilet paper typically spikes. Plus, I think also early on, we understood this was a virus, but one of the things that you heard was that you had flu-like symptoms. Well, that can mean different things to different people. Yeah. Plus, everybody's now home, right? We're telecommuting. The kids are not going to school. The college students are coming home. And so, I know one person had 1,000 rolls of toilet paper, and they shared that information. And so we did the math, and that is literally 30 years worth of toilet paper if they were to use it the way it was recommended.
Wow. Okay.
Hey, Doug, you know what else I see picked off the shelves? Ice cream.
Yeah.
So guys, I just wanted to share I just wanted to share with everyone, first of all, my appreciation to Sherry, Doug, and Chris for being our panelists today, and also to all of you for coming. We've had people here from Canada, from Hawaii, for East Coast and West Coast. So we're going to be doing more of these. Actually, next Tuesday At 5 o'clock, we're going to talk to the states. We'll be talking to Pennsylvania, Virginia, North Carolina. And then a week from today, same time, 4:30, we're going to hear from the technology sector. And also a little bit more about how to use the SICE, which is what Tom mentioned earlier today. So this is the URL for the SICE. Feel free to check it out and get registered with that. And personally, I just want to say thanks to everyone for attending. This is my email address. So if you have any questions, comments, feedback, please don't hesitate to email me here. And I think that's all we have for today. Thank you so much for attending. Bye, everyone.
Thanks, Laura. Thanks, everybody.
Thanks, guys.
Thank you.
That went good.